With Will having a neuromuscular condition, we anticipated that things would continue to progressively get worse. And it was interesting, he had a curve that wasn't necessarily compromising his breathing and his lung capacity. I think for many families, that's one thing that they look to, is if their child's having difficulty breathing. That wasn't really an issue for Will, but then he started getting more uncomfortable in his chair. We noticed that it was having an impact on kind of his hip position. And then he also, the driving factor was when his spine was over as far as it was and was causing skin integrity, and we were starting to have wound issues. And that was pretty scary, and that's when we said, this is time. So those were some of the factors for us.
Dr. Emans, you just smiled there.
He's remembering
I'm
probably.
just remembering now. I think that, not to sound overly graphic, but I think the spine was trying to poke out through the skin, and came pretty close at one point. So yes, I think that was a this needs to be done indication. But that's a very obvious indicator, and I think it was very obvious to Will's family that something needed to be done, because here's a problem. There is a definite problem that we have to try to address now. That's often not the case. Often the spine deformity or the scoliosis is an oh by the way problem, and there are lots of other things going on. The seizures are causing lots of trouble, or nutrition's causing trouble, or there's too much reflux, or there are recurrent pneumonias, or there are other things that are much more on the radar than the spine deformity, which is continuing to worsen. So in this case, there was a clear incentive to do something. In lots of cases, it's more us, the system, the providers, that say this needs to be addressed, and then it's a difficult or a different conversation, trying to bring the family along with what we perceive to be future problems. Because we are really proposing a prophylactic operation as opposed to an operation that helps the immediate problem.